So yeah, cool. All right. So basically for everyone, we typically do 30 minutes of content, and then we have a 30-minute Q&A. Today, because we have amazing guests, we've been on their schedule for about 2 months out, and it's a real treat. And so I'm just going to hand it over to them. They've got slides, and then we're going to email these out as well. We already have, and so we'll email them out again, put the link in the Facebook group as well. So they're going to do about a 30-minute presentation with their slides, and then a 30-minute Q&A where you can ask any question about medicine, supplements, safety, everything. And these are also, we have quite a few members in our group who have used the ADHD Center out of Greenville, South Carolina. Correct me if I'm wrong, Apryl and Heather, you guys are like the top in the South, right, for ADHD treatment?
Of course.
You guys, what's your ranking? It's very high.
Don't know our ranking.
We'll say that. Yeah, it's very high. So very great to have you. So I'm going to hand it over to you guys. You guys have, Apryl helped me find the perfect combo of medicine that's really worked for me. And I know we have multiple other people have used you. So thanks for being here. And I'm going to pass it over to you guys to do your bios intro, and then I'm going to give you the rest of the call. And we have a lot of people that watch the recording after as well. So a lot of people are going to be helped. So thank you for being here.
You're welcome.
Not a problem. So I'll start off. I'll share my screen here. Here we go. So my name is Dr. Heather Brannon. And pretty soon you'll get to talk to my partner, Apryl Watson. She's a nurse practitioner. We're co-owners of Greenville ADHD Specialists in Malden, South Carolina. We've been here for 10 years, and we diagnose and treat kids and adults. So what we want to talk about today are myths and misunderstandings about ADHD, and there are many of them. What most people know about ADHD really is, it's not just the tip of the iceberg. It's like the tippy tip, because there's a whole lot that's underneath, and it's pretty complicated. So if there may be some slides on here that have a whole lot of words, don't be scared. We've included them just for reference. So if you need that for later on when you have the PDF of the talk. So, and my other disclaimer is just if anybody here, if you feel like we're talking to you, we are. They're actually, I have a lot of patients who are realtors, and a lot of realtors have ADHD. And if you think about it, it makes sense, because you're moving around. You don't have to sit at a desk all day long. You're talking to people, and you want to help people. So it makes a lot of sense. So let's get started. So these are the things that we're going to talk about. It's very broad. So we're going to talk about what ADHD is, and how it's diagnosed, how you can find a provider, talk about treatment. So let's get into it. So the first myth is ADHD is not a real disorder. Yeah, I'm sure everybody has heard this, people saying, oh, that child just needs a good parent. He just needs a good smack on his butt. Well, that's my generation. That's not necessarily this generation. Or you don't have ADHD, you're just lazy. Yeah, people who say, I don't believe in ADHD. Okay. So you just have to realize there is no debate in the medical literature that ADHD is not real. There's just, yes, the answer is yes, it is real. There are lots of books that are written on it, thousands of studies that get published every year in scientific journals. It's recognized by the National Institute of Mental Health. It's recognized by the American Psychological Association, and it's recognized as a disability according to the Americans with Disabilities Act. So what causes ADHD? What's going on here? Well, of course, there's not one specific cause. That would be kind of nice. So we all have traits. We have things that that are unique to us, that characterize us, and a lot of us have similar traits, but some of us have we're kind of on the end of the spectrum when it comes to certain traits, like intelligence. You know, some people have a normal intelligence, some people have very low intelligence, some people have very high intelligence. So the traits that we're looking at for ADHD are inattention, and then inhibition and executive functioning. So for people who have ADHD, the point of this is those traits are way out, they're way out of the norm, and they cause impairments in a lot of different areas in their lives, and they also increase their risk for injury or death. So we know of at least 5 brain areas that are abnormal in people who have ADHD. If you know one person with ADHD, you know one person with ADHD. Nobody with ADHD has the same impairments. You know, some people have absolutely no trouble with their memory, and some people can't remember what somebody told them, you know, 2 minutes after they told it to them. So there's a lot of variation in these ADHD traits. And we know that variation, a lot of that variation is due to certain genes. And so the genes that are involved, there are 24 to 45 genes that have been involved. It would be nice if it were just one, but there are a lot of them. And the amount of variance that's due to genetics is just under the variance that's due to height or contribution to height. So if you see a mom and a dad who are both very tall, you're probably going to see a child who's very tall. So the percentage of the variation for ADHD is just underneath that, and it's actually more than the contribution to IQ and personality traits. There are other causes that aren't genetic, and a lot of those have to do with pregnancy that's not going well. So a premature delivery, very low birth weight, if mom is drinking alcohol, or malnourished, those are causes. Those are things that can cause ADHD. And we know that the genes that are involved make the neurotransmitters dopamine and norepinephrine less effective. So dopamine is it's a feel-good neurotransmitter, but we also need it for being interested in things. This should really be called interest deficit disorder, because if people are interested in things, they probably can't pull them away from it. But if they're not interested in the underwear on the floor, they're going to walk past it 100 times. So maybe somebody's coming over, they're going to be embarrassed if they see their underwear. So now they're interested and they pick it up. So norepinephrine has more to do with executive functions, like regulating yourself and organizing, prioritizing, things like that. So let's go over the official criteria. The point with this, and I'm going to go over the specific points that are required, but this is just kind of explaining things. The idea is this has to be something that's been going on a long time. It's not something that just started yesterday, and that's why there are criteria about how long and what age. These have to be people have to be impaired in more than one place in their life, whether it's at home, in relationships, at school, at work. And so, you know, it's impairing. And it also has to interfere with functioning, like how you do socially or how you do economic or academically. And then there's the criteria for how many symptoms people have to have. And obviously, you know, we don't want to diagnose something as ADHD if it's better explained by something else. So so these are the inattentive symptoms. I'm not going to go through every single one of these. I could wax poetic about every one of them, and I know you don't want to hear that. But these are the inattentive symptoms, and these are the hyperactive impulsive symptoms. This is not perfect. This is not the perfect explanation of ADHD, but it's what we have right now. The other thing to consider are the executive functions that I talked about, and that's it's self-regulating. So motivating yourself, stopping yourself from doing something, organizing yourself, knowing how much time has passed, or and then keeping a thought in your head long enough to do something with it. And so those are also an important part. So seriously, doesn't everybody have this? I mean, really, doesn't everybody at some point in their life have trouble, paying attention to what somebody's saying? Well, yes, everybody can have some of these problems. The interesting thing, so they did a study. They had a group of people, these are adults who have ADHD and a group who don't have ADHD. And they gave them certain symptoms and they said, is this a problem? And then they compared how many people said, yes, this is a problem, to the ones who said, no, it's not. So you can see this is just a few of them. Something like procrastination. A lot of adults who have ADHD said, yes, that's a problem. And a decent number of adults who don't have ADHD said that, yes, this is a problem. But something like forgetting the point I was trying to make when I'm talking to someone, you see there's a huge difference in that. And so, yes, everybody can have some of these things, but they're not impairing for everybody. So what are people with ADHD really like? And you'll notice that lazy isn't in there. Character flawed isn't in there. Those aren't characteristics of people with ADHD. So what is it like? What's it like to have ADHD? So usually in high school, college, that's when people are setting up systems to make sure they can get things done and things don't fall through the cracks. And that's everybody. But for people who have ADHD, at some point in their lives, as life keeps pushing in on their systems, things start leaking out and they have trouble remembering things. They have trouble getting things finished. They have trouble getting things started. And they usually feel ashamed about what's going on because they think, I just need to try harder. I need to be more self-disciplined. So there's this constant conversation going on inside their heads where they're berating themselves because they're usually perfectionists and they're harder on themselves than other people are. So this is someone who's driving somewhere going, oh my gosh, I can't believe I'm late again. I knew what time I needed to leave. Why didn't I just leave? Why did I have to look at that last email? I thought it was going to take me 2 minutes to write a response, and 20 minutes later, the stupid thing still isn't written, and I'm late. And I would say I'm going to do better next time, but I say that every single day and nothing changes. So WTF? So this is inside head conversation. And then they start hearing it on the outside of their head. You forgot. How could you forget? I told you 10 times. Are you listening to me? Do we need to get your ears checked? Or how could you go to the grocery store and all we needed was bread and milk and you come back with $150 worth of groceries and no bread or milk? How does that happen? So they're hearing it on both sides of their head and they start feeling bad. And feeling bad takes on many forms. And a lot of times in adults, it makes them anxious. Whether they feel anxious or not, they know something's not right. And they'll make monumental efforts to make it right, but it's still not right. And they're usually waiting for the other shoe to drop, for everybody to figure out they're not as competent as they appear. They're actually competent. It's just they see what's going on behind the scenes and all the piles that are piling up, all the inefficiencies and all the effort that it takes to get things done at the last minute. And these are some of the worst sleepers in the world. So this is someone who's just laying awake at night, just staring at the ceiling. Brain is just churning with everything that needs to get done that hasn't gotten done, because brain thinks, maybe if I just keep it all right here, maybe it won't be get lost in a file cabinet back there. Maybe tomorrow won't be as stressful as today was. It doesn't really help, but brain is trying, so you have to give it credit for that. So this is what ADHD looks like. These are some statistics, and I'm not going to go over all of these, but this is a real disorder, and a lot of people have it. So I'm going to end here, and I'm going to stop sharing, and April's going to take over.
So moving on to myth number 2, which is ADHD is overdiagnosed. I think this has been in the news media a lot recently with medication shortages for ADHD and things like that. So questions of, why all of a sudden is this a problem? Or too many people being diagnosed? Are they really getting an accurate diagnosis? So what we do know is that as of 2022, clinical diagnoses have increased over time. But it is thought that a couple of things are responsible for that. First is more awareness among healthcare professionals, medical providers, and also parents. So with more awareness is going to lead to more questions, more conversations with, healthcare providers about symptoms, which are going to lead to more diagnosis. Also, primary care providers are doing more screenings. So when you screen for things that you used to not screen for, you're going to pick up on things that you have missed in the past. And that also leads to more diagnosis. And this is a big one, decreased stigma about ADHD. I mean, we're all talking about it right now, which 10 years ago, this group didn't exist. And so more people are sharing their experiences. Social media is a big one. Now, not everything you see on social media is going to be accurate, but we're talking about it, and that's that's the first step in breaking down barriers and stigmas. And also availability of better treatment options. So science progresses, there are better treatment options that come with less side effects and things like that are going to encourage people to, not be afraid to get their, ADHD treated as maybe they were in the past. Another important thing to consider, though, is that data continually suggests that ADHD is actually underdiagnosed in females and non-Caucasian populations. So this is a big group of people that are not diagnosed as of this point in time. So we know that that over time there are going to be more diagnoses. We're missing a lot of people. So as time progresses, we will have more accurate diagnosis of ADHD. And then this is more about treatment, but what we also know is that ADHD, the rates of treatment continue to be lower than the rates of diagnosis. So we know that as a whole, it is undertreated and not overtreated. And that kind of goes back to medication shortages and kind of theories around that and things like that. But we do know that we still have a lot of work to do for folks who have untreated ADHD. So historically, the disruptive, hyperactive, rowdy little boy was what came to mind when people thought about ADHD, but we know that only a small amount of children are overtly hyperactive. And then so often it goes missed. It isn't diagnosed, or it isn't diagnosed until later in life because people aren't fitting this picture, as Dr. Brannon gave great examples of before. And there is no diagnostic criteria for adults with ADHD that has been validated by research. So a lot of times healthcare providers look for guidelines to diagnose conditions of all sorts. So there's this, for some reason that I don't understand, there's this way of thinking among a lot of healthcare providers that when a person turns 18, their ADHD just magically goes away. It just gets better. But those children who have had ADHD turn into adults who still have ADHD. So it is true that adults can be diagnosed with ADHD for the first time in their lives. So if we, if we think about it, we do want to recognize that, yes, there are people who are inaccurately diagnosed with ADHD. That does happen. But the bigger problem here and the bigger takeaway is that many people with ADHD are actually missed. So moving on to getting evaluated for ADHD. So something to keep in mind is there's not just one test to diagnose ADHD. When you go to seek an evaluation for ADHD, a big thing to think about is you want to seek an evaluation with a qualified licensed healthcare provider that has experience in diagnosing and treating ADHD. So that's a big deal. Let's see. It didn't come up. Yes, there it goes. So professionals that can diagnose ADHD, so physicians of many different specialties. Also in most states, I know we've got probably a lot of people from different areas, but and this can vary by state, but most states, nurse practitioners and physician's assistants can also diagnose ADHD, and also psychologists can diagnose as well. So before heading in for an evaluation, or things you want to check with the office staff about to kind of get some more information and know what to expect. The first is, how long has the healthcare provider been working with patients with ADHD? And that's huge. So, this is not something we see, or, we've been doing this for 15 years. That's gonna, give you a good idea at their experience level. The other thing is what is involved in the initial evaluation process. So what tests are performed? Is objective testing performed? This is a big one. So at our clinic, I know different clinics are going to be different, but at our clinic, we do lots of questionnaires. So that would be subjective testing, where, we're getting information from the person. But we also do objective testing, and we use a test called QB test. And QB test is it's a test approved by the FDA to help us diagnose ADHD. So it aids in diagnosis. And so what it's capturing is a person's movement, their ability to focus and pay attention, and their impulse control over a period of 20 minutes. And the last thing is what costs are involved in an evaluation. So a lot of times with insurance companies, they don't cover costs for specific or more specialized ADHD testing. So that's really something that you want to know going up front. Many times you may run into offices who are, cash pay. They don't accept insurance. It's kind of pay out of pocket sort of thing for that reason. So those are definitely good things to know ahead of time. All right, so how do you find a provider with experience in diagnosing ADHD? So I've listed 3 sources or resources here for you with links. So the chat directory, attitude directory, and also Psychology Today. So with all of these directories, you can kind of search by your area and location. I didn't put this on here, but it just come to mind that word of mouth is another great. Word of mouth is a great, and maybe the best resource.
I'm gonna do a plug for you. If you're anywhere near Greenville, South Carolina, these are the people that, Apryl especially. She even has a calming voice. I come in there and I feel calmer after. But knew about the fillers in certain ones and what was generic and what wasn't, and the same kind of medicine was giving me a panic attack, but a different form of it wasn't. And so and I'm going to type the link in the chat. So if you are near Greenville, South Carolina, I drive about an hour and a half to go there out of state. They're really great. So I don't get a referral fee or anything. Right? You can go to anybody, and there's a lot of people in the community that go to them. So again, and just throw another plug just because I'm so grateful for you guys. So I'm going to drop that in the chat. And you can work with people out of state, right? But they have to drive there, and they have to go there every 90 days, I think, for you to see them in person. Is that right?
Yep. So we do some out of states. We we do accept, and yeah, our office staff would be happy to explain those details for sure.
Okay, I'm gonna type that in the chat. Sorry to interrupt.
No, that's okay. So, so how do you know if you found a good provider? These are, so I'm gonna go ahead and bring this list here. So these are kind of like first impression things. You know, just things to think about. First, and maybe most important, is they listen to you and you feel heard. It's not going to be a 10-minute visit, a 15-minute visit. You cannot accurately diagnose and understand a person's symptoms and their struggles and their functioning in that amount of time. So that is huge. They don't make you feel like you're just wanting drugs or you're drug seeking, or there's different terms for that. But you know, if you go in to talk to someone about their ADHD and the first thing you say is, I can't focus, I'm having trouble focusing, and they say, well, I don't prescribe Adderall, you know, just leave. That's not going to be a good fit. Another thing is they can explain their reasoning for recommendations with more than just saying, well, that's just the way it is. So if a provider actually understands ADHD and all the things that are happening behind the scenes about ADHD that go into it, they're going to be able to answer why and give you information about the questions that you may have. The other one is they don't tell you that typical treatment is illegal. So kind of going back to, you know, not making you feel like you're drug seeking and things like that. They write down instructions for you instead of making you remember them. So this is a big one. So if you're, you know, if they're giving you instructions and you leave and, you know, it's the next day and you're like, oh, I forgot what they said, but then maybe you feel ashamed about calling and asking what that was. And that might be, you know, you may be missing a very important piece of instruction or something that you may be doing. So people who understand ADHD realize that things are going to be forgotten, and want to make sure that you have the information that you need to succeed. You can contact them in between appointments and they respond, rather than, here's a prescription, I'll see you back in 3 months. That's not good ADHD care. They can give you options, so options for treatment, medication, non-medication wise, and they're supportive and encouraging. So moving on to myth number 3, this is the last one we will go over before questions. And this one is ADHD medication is bad. Well, actually, it's just the opposite. So having untreated ADHD is actually going to increase the risk of these following things. Low self-esteem, depression, anxiety listed first. Depression, anxiety, about 80% of folks with ADHD symptoms are going to experience these things as well. Difficulty in relationships, also negative parent-child interactions. Job instability. So, you know, Dr. Brannon mentioned like being late. I try to be on time, but I'm late. So excessive tardies, making mistakes, getting bored and feeling like I have to switch jobs every 6 months or every year. Increased likelihood of substance abuse. So this is, you know, drug abuse, alcohol, definitely lots of research connecting untreated ADHD with these things. An increased mortality rate. So whether that be motor vehicle accidents, there's lots of research on the connection between MVAs and ADHD. Risky behaviors, high risk behaviors, not taking care of ourselves. So not going to primary care, not, you know, following up on our blood pressure issues that all can lead to earlier death. So what we do know is that appropriate treatment reduces these risks. And we know that because there have been long-term studies that have looked at groups of people who have ADHD, who take medicine, and who have ADHD that do not take their medication. And there's absolutely no proof that taking medication increases any of those risks. So you may ask why medication is important. Well, stimulants, which include methylphenidates and amphetamines, to treat ADHD, actually increase the amount of neurotransmitters, norepinephrine and dopamine that Dr. Brannon mentioned earlier, in our prefrontal cortex. So that's in the front part of our brain here. There's a area called the prefrontal cortex. And what this is it's a very important part of our brain that plays a key role in complex cognitive, emotional, and behavioral functions. So stimulants are approved by the FDA and are considered first-line treatment for ADHD. And actually that's in ages 6 and up. So there's lots of research that medication for ADHD, whether it be stimulants or non-stimulant treatments, are safe and effective. And an important thing to think about, though, is that these medication treatments do not cure ADHD because there isn't a cure, but they're very highly effective at improving symptoms, and they're first line for a reason. So I'm going to move on now to some complementary treatments, non-medication wise, that can be beneficial with ADHD. And the first is a healthy, well-balanced diet. So, whole foods, protein, limited sugar, and processed foods. And the second thing is going to be sleep. So for most people, getting 7 to 8 hours of consistent sleep and practicing good sleep hygiene. These two things are kind of the foundational things. So, no matter what treatment you're doing, if these two things are not going well, the other treatments aren't going to go well. Exercise, so that can help improve our cognitive function, can help improve our sleep, and also stress management. And then you've got supplements. We could spend the whole half hour talking about supplements, but these are kind of basic things. So if we're starting out, we want to look at zinc, make sure we're getting zinc, magnesium, vitamin B complex, vitamin D3, and omega-3 fatty acids. I didn't list doses, dose ranges, but you can find those on the internet. Just make sure that you're using a reputable resource source for the daily recommended values. Cognitive behavioral therapy. So this can help with understanding our symptoms, ways to manage them, and licensed counselors and psychologists can help us with that. Here is a link for Psychology Today, where you can search for counselors and psychologists, and you can also filter by ADHD. That'll kind of funnel the ones that have ADHD experience out for you. So ADHD coaching. So coaching can help with executive function. So again, helping with executive functioning, learning strategies to help improve. Coaching is different than behavioral therapy. And you can search for a coach at adhdcoaches.org. And last but not least is mindfulness. So moving on, we got some more information for you all, just so you have access to in the future. First are some websites listed here. Dr. Brannon did a TED Talk in the past, so I've listed or linked that talk for you. I mentioned QB test being an objective test that we use in our office. Their website is linked here. I've got good research behind that as well. And of course, our website's listed. And then these are going to be some books. So there's lots of books, lots of resources for ADHD, but these are good places to start. Just references for our presentation today. And then this is our contact information. So if you need to find us in the future, if you have questions or, comments, whatever it may be, this is where to find Dr. Brannon and I. And so now I'll just open up the floor for some questions.
There's a couple questions in the chat. So one I see is, she said the 2 ADHD meds she's tried have given her bad muscle pain and inflammation, and she's going to try the herbal route. I don't know if that's a question or not. I didn't know if you had a comment on that. So she's tried 2 and both have given her muscle and pain and inflammation.
So there are many, well, there are a lot more medications than just 2. And so the things to think about are whether somebody picked a dose for you and gave it to you, or whether you were able to find a dose that worked. Because if the dose is too low, you're going to have side effects. If the dose is too high, you're going to have side effects. There's a sweet spot where the medicine is at the right dose, it works, and and that's where people have minimal side effects. Yes, some people can get those kinds of those side effects with certain stimulants, but there are so many other ones to try. I would never say don't do supplements, but I wouldn't give up just yet.
That's helpful. And one thing I'll say, what I really loved about the Greenville ADHD Center is they also had a list of supplements, and aren't just purely only take meds and that's it. They're just always learning and finding things. And so so herbal and everything. So we have another question. Is the red dye thing really a thing? Red 40.
For a lot of people, absolutely. Again, it's a thing that everyone's different. Gluten is another thing that people talk about a lot. I have had patients who stop, eliminate red dye and have tremendous improvement in whether it be their, kind of core ADHD symptoms, not to the degree that we stop treatment, but and it could be like, brain fog, sleep is better, things like that. So absolutely, it can make a big difference for a lot of people, and it's a trial and error thing, I think, too. So, people go on a trial for 3 months. I'm going to eliminate it, see how I feel. Do I have any difference, in my symptoms?
Are there any other things in our environment, our world, like red 40 that's common that can make ADHD worse?
The interesting thing is a lot of people with ADHD have allergies, but also sensitivities.
Mhm.
So, the gluten thing, I don't have one patient who's done a gluten-free diet who hasn't said that they feel amazing afterwards. Dairy can be a problem. So there can be a lot of different triggers. It would be great if we knew all of them. We still have to live in the world, but it's very common for people to have sensitivities.
So gluten, dairy, some of the dyes, red 40, those. Did I miss anything else?
Sugar, processed foods.
Dang it! Come on. No.
High fructose corn syrup, aspartame. So yeah, we just have a lot of chemicals out there.
Mhm. Yeah, and if you think natural whole foods, fruits, vegetables, things that you can grow.
Someone asked about fish oil, and I know, Apryl, you've worked with me on that. There are certain supplements that you can take, right? So could you speak to fish oil and then anything else you'd recommend people take?
Yep. So fish oil, that's kind of lumped in under those omega-3 fatty acids. So you all can just kind of Google. You can even just Google like foods high in omega-3s, and look and see. Again, kind of going back to the natural route, like it's great if you can incorporate that through your diet, and not necessarily need to supplement. But a lot of people are falling short and very short, or not any at all, and that's where a big problem lies. So yes, and then you want a good quality supplement too. So gosh, what is the brand that
Seeking Health.
Seeking Health, yes. Yes. It left me. Optimal Fish Oil by Seeking Health is a good, it goes out of stock often. And I feel like that's been a problem recently, but that gives you an idea.
And if anybody reach out to me, because I'm on the protocol that Apryl has recommended with the right ratio of DEA and EPA. So shoot me a message if you want to know what, if it's out of stock, the alternative that I've researched that fits the criteria. Just let me know. I'm going to go to and we can always jump around. The next question, her primary care provider doesn't want to give her a stimulant medication because of her age. She's really healthy, but over 50, and Strattera isn't working. Should she push back on that?
Yeah. The oldest patient I've started on medicine is in their 70s. You know, I'm 56 and I'm taking medicine, and I have for a long, long time. You know, I'm not too old to have a good quality of life. And if you can think, then if you're doing things and you're not a vegetable, then you have a it's okay to be able to think better. There are actually a lot of studies that are coming out on starting older patients on medication, and there's not a problem with it. Honestly, they're not really common. You know, if you have terrible arrhythmias, you know, you're probably going to realize that a stimulant may not be the best for you. But even with other medical problems, a stimulant is probably going to help.
Okay, next question. How likely is it for siblings to have ADHD? He has ADHD. He's got 2 siblings, and sister has some signs. So what is the frequency that your siblings have it too?
So the interesting thing with that is, the closer you are to somebody genetically, the more likely if one of you has ADHD, the other one will. So identical twins, the likelihood that both are going to have ADHD is like in the 90%. You know, non-fraternal twins, it's a little bit less. You know, just siblings is a little bit less. Second cousins, yeah, that's far enough removed that they you know, there may not be a huge correlation. You can't necessarily say, well, my second cousin has ADHD, so I must have it.
Okay, next question. What do you suggest? She said she wakes up without energy no matter how much sleep she gets or quality of sleep.
You want to do that one, or you want me to?
Well, I feel like you're very good at that. Explaining that.
So a lot of people with ADHD have sleep disorders, like restless legs and sleep apnea. Interestingly, a lot of times when we start somebody on a stimulant, they stop snoring. So it's something to consider. But you know, the other thing is, if you know, people sleep better when they're taking a stimulant. I don't want to sound like I'm just a broken record, but they really do. So I would say it's a good idea to have your sleep evaluated, and you know, and see if you have any sleep disorders. And treating those can be very life-changing too.
Yeah, let's see. Okay, so other people kind of commenting on the energy stuff.
Yeah. I mean, dopamine has a lot to do with energy, and you know, when dopamine is low, then energy is definitely affected.
Is there like diet? Is there a certain, you know, diet or a certain food plan, or just intentionality around? I know you mentioned whole foods, but is more protein better, or complex carbs, or keto, or vegan? Have you noticed any kind of correlation with that?
I mean, high protein, complex carbs, avoid the simple ones. They just turn into sugar, and that spikes our blood sugar, and then that impairs our attention. And that's a process that's gonna impact with or without ADHD, but gonna be, you think of it being more amplified, you know, when you're trying to treat your ADHD. So protein, you know, complex carbs, you know, limiting sugar, simple carbs, and processed foods, I think is kind of a good place to start. But there, you know, you mentioned like keto or the special, you know, other Mediterranean diet and things like that. Again, I think it's just everybody's so unique and individual. You know, it's kind of like take those main points. Like I need to focus on getting a lot of protein to sustain my blood sugars and not have a lot of spikes throughout the day. You know, take that and then kind of figure out what direction, you know, you want to go into, and then in trial and error to see what you feel well with.
What would you So if someone's got substance abuse history, right, and maybe they're a little nervous around stimulants or maybe not, how would you address that with someone that comes to you for medication? Would you put them on stimulants? Would you do non-stimulants, or how would you decide whether to do that or not?
So when people are self-medicating with recreational drugs, alcohol, even cigarettes, then if we take care of the problem, that's the actual problem, instead of trying to self-medicate with something that's not fixing the problem, then that helps out a lot. So for addictions, if somebody has a remote history of addiction to whatever, I'm not really all that worried about it. If they've been going on well and they're not having problems, we'll start patients on medication, even if they're in the process of getting off medication, because that can help. That's usually if they're being seen by an addiction therapist, like they have somebody that's helping them through that. If they're just on their own, then that can be a big problem. And it also depends on what they're addicted to. Opiates increase dopamine, like stimulants increase dopamine, and so not exactly the same way. But it's another one of those self-medicating. It's easy to get somebody's Lortab and find out that you can focus better with it. And so changing them over to something that's actually going to work can make a huge difference. Somebody who's just getting off meth or cocaine, that's a different animal, and they definitely need to be in treatment, or in treatment. A great resource for addictions is if you go to YouTube and do a search for "Put the Shovel Down," it's Amber Hollingsworth, and she's the owner of like the best outpatient addiction place that I've ever seen, and she has all kinds of information about addictions and also treating ADHD with addictions.
This is the next question. Okay. What are some tools that that can help with productivity, that can help this person do the hard stuff? She struggles with a lot with executive dysfunction and just freezes. What do you recommend?
So there, under the resource page, there's like there's an executive function workbook. Ari Tuckman's great. Attitude magazine link that we gave is a great resource. It has a little search box at the top, and you can type in keywords. So productivity tools, executive dysfunction, things like that, keywords, and it will generate lots and lots of articles or webinars, and they're not very long. They're kind of really to the point, that can point in the right direction. Now, if you're looking for someone to kind of walk along beside you a little bit and coach you, that would be like ADHD coaches are great for that. And then on that slide that we mentioned ADHD coaches, there's a link to, I think it's ADHDcoaches.org, and you can search for those that are certified. You definitely want a certified ADHD coach.
Next question. So this person was prescribed a stimulant a couple of years ago, but they were told to use it as needed and not every day. But they're having more problems keeping a consistent level of functioning. So thinking about taking it daily, adding an afternoon dose when it wears off. They ask, how concerned should I be about developing a tolerance? And is there thinking that having in your system daily is more beneficial?
If all we were doing were giving people drugs for performance, just performance enhancing, then yeah, you should just take it when you're doing that, you're doing that performance. But what we're trying to do is correct deficiencies in chemicals in your brain, and so you need that corrected all the time. And people actually do best when their stimulant lasts all day long and wears off an hour before bedtime. So So yeah, there's no need for a drug holiday. There's no need. It's just you're kind of selling yourself. Well, that's not a great way to say it, but you're missing out on a lot if you just take it when just at certain times. And that's where having somebody who can help prescribe for you, because all the different stimulants wear off in different times. And so a lot of times we have to do combinations so that they fit your life. Your life shouldn't revolve around somebody's arbitrary idea about medicine. Like, okay, I can only focus for 4 hours today. What 4 hours am I going to pick? That's not reasonable. We wouldn't ask somebody who's a type 1 diabetic to just do some insulin, for lunch. That's it. You wouldn't, it's just, we wouldn't expect that. So.
And I know mine helps with emotion regulation. And so why don't I get to have regulated emotion on my days off and actually enjoy? Is it just about me being productive and, focusing, and then on my days off, I'm floundering and, I don't get to use the good traits as much.
And your family gets the worst of that.
Right.
The people, because they're not seeing you during work hours, and most people are going to choose work hours to be able to focus. And, conversations are more interesting. You're less irritable when you're taking medicine. You still have to think, you still have to drive, not like a drunk driver. It's important that, we really do think all the time.
And they talk about the tolerance, and obviously correct me. My understanding, let's say I'm on medicine and, I've been on the same one, Apryl knows, and we tried to go up a little bit because I wanted to, and it was too much. So I've been on the same dose for a couple of years. So not everyone develops a tolerance, right? And if you do, even if you get to the max dose, then wouldn't you shift to a different kind of similar med and let me come down off of the original? It's not like and then go back to, it's not like I'm stuck now and I need 100 milligrams of whatever to be normal, right? Is that how that works? Or
so, to be honest, tolerance rarely happens, and that's because you have to get to the right dose in the first place. And once you're at the right dose, then for adults, typically, that's usually it. I mean, I have people who I've been seeing for 15, 16 years, and they're on exactly the same dose now that they were 15, 16 years ago. And that's what I would expect. A lot of times people feel like their medicine's not working as well. And most of the time that's because they're not getting at least 7 hours of sleep. But there can be other reasons. It's just rare that once we find what works, we really don't have to make changes. I worry so much more about tolerance with if I prescribe opiates or benzos like Xanax, that kind of stuff. That happens way, way more often than it does with stimulants.
Another question, and is there a difference in the efficacy of taking medication if taken with food versus without, versus an hour before, food, beverage, the timing of those things?
There can be, for some of the stimulants, it's like certain foods can make them less effective, and that's because vitamin C is one of those things. So, and not every stimulant, but there are quite a number of them that, and again, not everyone has the same experience, but it can, vitamin C can, alter stomachs or the acidity, pH levels. And, a lot of ADHD medicine is released and it's based on pH and different kind of things like that going on in our GI tract. So, so there are things that can interfere with the absorption of medication. I always recommend, clustering activity. So, we want everybody to start off their day with good protein and eat and take care of themselves. So that's usually what I say is that, protein, medication are the good ways to start your day.
Thank you so much. You guys are just wonderful. And it's, I'm a nerd and learning about ADHD and all this stuff. And obviously don't have a degree like you, and it's just amazing. Even what I've seen, there's even less stigma and less risk than I even found in online from affirming sources. It just sounds like, what do you think has created a lot of the stigma or kind of fear around medication, or what do you think caused that?
Honestly, I well, I think it's because doctors especially, but any medical provider, they don't take the time. It takes time to talk to somebody with ADHD. It's not a quick kind of appointment. And people need to be heard, and they need to be heard in the way that they need to speak, not in the way I want to hear. And so I think a lot of the problem is, you know, providers just don't even want to open that box. They don't even want to get into it. They don't realize how life-changing it is. That's just my opinion.
Anything else, April and Heather, you'd like to add?
No.
There was one thing. So somebody was saying they were frustrated because their primary care provider talks about taking them off of medicine. Yeah, you need to be on it all the time. You have to think. You have to think all the time. So there are no guidelines out there that say that when you reach a certain age, you have to stop taking medicine. There are actually studies that show that taking stimulants for older adults who have, like for the elderly who have depression, that they actually do well with stimulants. So there's just not a reason. There's no hard and fast rule that you must stop at this age, assuming that's an age thing.
And kids too. I mean, I read something that if kids are on medication as a kid, sometimes they're less likely to have to be on meds as an adult. Is that right? Or
Yep.
That is
Yeah.
correct.
Mhm.
Yes.
Yeah,
So
before the
before
age of
age
10.
9, age 9. And so it's early diagnosis, early intervention. It really can change the trajectory for children and into adulthood.
Yeah, and for the person who says, I know there are doctors who believe that ADHD isn't real.
Yeah.
We know how to know if something is real or not. That's just disregarding lots of medical evidence.
Science.
It's just I don't know. I don't think that's good at all.
ego? I mean,
That can be part of it.
Possibly.
yeah.
And seriously, but if you recognize, if you're a provider and you recognize that ADHD is a real thing, now you're going to have to ask a lot of questions, and you're going to have to learn a lot. And it's just, that can be too daunting for some providers who are just used to spending 5 minutes with a patient.
Mm-hmm. Right.
So I know we have one more question. He said, I heard you when you go on medication and you basically correct your behavior or gain better habits, then you may be able to get off the meds. Does that sound correct? No? Okay.
Nope. So somebody who's a type 1 diabetic, do we expect that they're going to take insulin and that's going to fix their problem and that they can stop using insulin? Does a postmenopausal woman just need to take her estrogen, and we expect that now her hot flashes are going to go away when she stops taking estrogen? Same thing with thyroid, somebody who's hypothyroid. No.
When you really stop and think about what's behind ADHD, it's a chemical issue. And so you stop treatment, it goes back to the way it was before. Now, it is true that your symptoms can change at different parts of your life, and look different and, present different. That's absolutely true. So maybe someone's hyperactivity isn't presenting in the same way, but that doesn't mean it ever really truly goes away. So if you think about it being a chemical thing, just there's no cure. So just taking that for 3 years or 5 years, yes, you may develop good coping strategies and put all these things in place. But once you take your ADHD treatment away, your dopamine and norepinephrine go back to the way it was before, then you're going to get tired of keeping that same routine. You're going to forget to do that one thing that you used to do at 11 o'clock. So yeah, it's unfortunately that's not how it works.
That would be the exception, not the norm. Being able to stop medication. There are people who are, impairments are on a very broad spectrum. So that's not a hard and fast every single person, but the majority, 98% of people, that's just me making that up. I would just pretty much count on until we come up with something better. This is the best thing that we have.
Yeah, I had an ADHD coach. I had a question like, I have to be on meds the rest of my life. And so the way that he reframed it is kind of like prescription glasses. Like, you don't have to put your glasses on. You're just not going to see as well. And it's going to be harder to go about your day. So wouldn't you choose to, put on your glasses? So here's another question. It seems like this person says different people have different levels of ADHD, some severe, some not as severe, and maybe environment plays a role or not. How would you speak to that?
Well, and that's where a lot of that variation comes in, variation in gene defects. There's a lot to that, but there's also epigenetics. So your environment can turn on and off genes. What coping skills you've developed, whether you learned good coping skills from your parents who have ADHD, who have, difficult coping skills. So, yeah.
You talk about stimulants and ADHD. Is there a correlation with ADHD and a caffeine addiction? That's from Matt.
Yes. So caffeine, you can think of it as a substance that people use to self-medicate. So absolutely. Caffeine can increase dopamine as well. You think about sugary foods or carbohydrates, people talk about comfort foods. That's another thing that people say, no matter how hard I try, I can't quit it. And it's because, there's this surge of neurotransmitters being released when you indulge in those things. So yeah, it really comes down to a way of self-medicating.
So if there's anybody who has like food stuff or, you overeat sometimes or spending, knowing that your brain's just trying to get dopamine, right? Or neurotransmitters, like you said, that can remove some of the shame. It's not that you're low self-control or whatever. It's like your brain's really trying to like self-regulate. So like you said, if you can do that in other ways and still give yourself that versus just shame yourself, is that what you recommend if people are going towards food or maybe things that are creating dopamine?
Yes, because it's healthier. It's more controlled, it's healthier, stimulants aren't going to cause you to develop type 2 diabetes. So, but drinking 3 liters of soda a day could eventually, so it's, yes, it's good to get treated and not have your brain, constantly kind of searching for, how do I get more dopamine?
And it's unique because your brain can send you, it can influence you, and it's trying to replace the dopamine. So we talk about appetite suppression when people are on stimulants. That appetite suppression, especially in adults, it'll go away usually in a month or two, but the carb craving doesn't usually come back when appetite comes back. So now you can open up the pantry and go, what do I want? And you can actually listen to what your body wants, and it wants the broccoli. It does not that you have broccoli in your pantry, but it doesn't want the cookies. Your brain's not hijacking and hijacking your decisions and overtaking good decisions with help me.
It's amazing. Thank you so much for being here and spending time with us. And I mean, just you're probably watching the comments. We're all very, very grateful, and I think you'll probably get some people coming to your clinic, which yeah, and I'll endorse you till my, what is it, your eyes bulge out, your ears, I don't know what the old time saying is, but yeah, I stamp of approval and stamp of gratitude. So thank you. I did put a link in the chat with the slides. I'm gonna email that out. Like I said, we'll email out the supplements, all of the links, and then yeah, have a just a wonderful time. Reach out if you need anything, if you need me to make an introduction, and yeah, thank you for being
Thank
here.
you so much. Thanks
for having us. Yeah.
Oh, thank you. All right, take care, everybody. Have a great rest of your day, and we'll talk to you next time. All right.